At any point in time, if the patient begins to cough, that's what we call an overt sign of aspiration, meaning food or liquid has gone down the wrong direction. It's really important to make sure that you don't give the patient something else to drink to keep them from coughing. It's really important to make sure that they cough until they're done coughing and then swallow, and make sure that they're fine, they're not needing to cough again. And keep in mind what they were coughing on. Was it food? Was it liquid? And make sure to let the speech pathologist know what you've seen, so that we can make sure that we confirm the patient's on the correct diet and make changes as needed.
Some other signs of aspiration that you may see that it's important to let your nurse and your speech pathologist know about would be the coughing, as Julie said. Other things might include clearing their throat very often, having a very wet vocal quality, having runny nose when they're eating, watery eyes, choking, are all different things that you should look for. And these are all signs that food or liquid is going into the trachea or down the wrong pipe. And those are all things that we can help the patient to overcome.
Thank you.
This tray is an example of the puree diet. Please notice the prepackaged puree, pot roast with green vegetables and mashed potatoes. The soup is also a vegetable soup which has been pureed. And the dessert is a pudding, which is considered a puree. This is the puree diet. This is an example of the mechanically altered diet. Please notice the ground meat with the gravy, the fork mashable carrots, and the soft mashed potatoes, the canned pear halves, and the soup is also ground up. The cake is also fork mashable. This is the mechanically altered diet. This is the example of a general diet. Please notice the salad and the roll. Another thing allowed on this diet are fresh vegetables. The vegetables on this plate are steamed vegetables. They're a little bit softer, but the vegetables on this diet can be fresh, like in the salad. Notice the meat, it can be the tougher meat, or it can be the soft, like a baked chicken, that's not as tough. This is the general tray with no restrictions on it. It has the thin liquid as well, the Coke.